Colorado Public News sat down with members of the House of Representatives from Colorado to determine how they're voting on repeal of the health care bill and what provisions are causing them to vote yes or no.
I don't think it'll be a surprise to anybody. I'm planning not just to vote no on the repeal of the health care bill, but also to actively whip to count as many votes to vote no as possible. The health care bill that Congress passed last year is just starting to take effect, and families are beginning to see some real positive benefits. They're able to enroll their kids up to age 26 now on their insurance policies. People can't be excluded from coverage because of pre-existing conditions. No longer can insurance companies discriminate against women on the basis of gender, and seniors are actually beginning to see some relief from their prescription drug prices in the donut hole. These things are all going into effect right now. And if we repealed the health care bill right now, not only would families not to begin to see this effect, but also, according to the Nonpartisan Congressional Budget Office, repeal of the health care bill would cost $258 billion towards our budget deficit in this country. So we just can't afford to do that. It would cost jobs, and it would put a real burden on mainstream American families. Ever since the health care bill passed, about a quarter of the new jobs that have been created are in the health care field. And as we begin to put more and more Americans into health insurance, there's going to be a lot more jobs for everything from hospital administrators to nurses to paramedics. And and also a budget deficit that of the size of $258 billion would really be an impediment to our economic recovery in this country. I can tell you 3 provisions that are going to affect my family. And so if they affect me, they're going to affect millions of Americans. The first one is, I have a daughter graduating from college this year. She will be eligible to be on my insurance policy until she is age 26 while she goes to graduate school or while she's working and getting a job with insurance. The second thing, my other daughter, who's 17, has a pre-existing condition. She has a chronic disease. If I lose my job or if I can't get insurance, she wouldn't have a way to get medical coverage. Under the new health care law, she cannot be excluded from insurance coverage. And then, of course, the third thing is, my insurance rates as a woman cannot be higher than those of my husband simply because of gender. So these changes are going to benefit American families. They're going to be able to afford their insurance in a much better way. And as the bill continues to get implemented over the next couple of years, you're going to see even more positive benefits for American families. Whenever you pass a bill of this magnitude, you're always going to need to be improving it and making it better. But I do think what the bill does is it puts a structure in place that will allow us to give insurance coverage to every single American, and that's really our goal. One of the ideas that I had that I would like to see added as we do that is the idea of enrolling all newborn children into health insurance. We call it auto-enrollment. And when they're born, if the parents don't have proof of insurance, then they would be automatically enrolled in insurance for a year. That would give well baby care to every baby born in this country. I was unable to get that fully into the bill, and that's one thing I'm going to be working for as we move forward. The new health care law provides a number of important provisions for children. Families who enroll in the exchanges in a few years will have a much easier time getting insurance for their children. Also, lower income children who are on the state insurance program now and in Medicaid will have guaranteed checkups, guaranteed immunizations, and that's going to be great for the health of every child in this country. And then finally, children with serious pre-existing conditions like diabetes or asthma, they won't be able to be thrown off insurance now, and they'll have quality health care. All of those things are going to be important for kids. I think it's a shame that Congress is wasting its time next week passing a repeal of the health care reform bill in the House, not only because it has so many benefits for Americans, but because it's never going to become law. And I think it would be much more productive on a bipartisan basis to examine the law that we passed and see how we can both improve the insurance services that we can give to Americans and also how we can reduce costs so that we can quickly get everybody enrolled in health care in this country. The vote next week is going to be just a political vote intended to appeal to the base of the Republican Party, but it won't pass the Senate, and it certainly won't survive a veto pen of President Obama. And so I think it would be much more important to have a constructive dialogue about how we can truly give everybody health insurance.